Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care from Raleigh. This is Eye Sports Safety Month, so I just wanted to cover a few of the common sports where eye injuries can occur and a few ways that they can hopefully be prevented. Most commonly, eye injuries occur with baseball, basketball, racket sports, hockey, and many times these can be prevented with proper eye protection during the games. With baseball, we particularly worry about balls of that size. When they hit the eye, they have a chance that the socket cannot completely stop the ball, and it can actually have a pretty great impact directly on the eye. One of the things we believe as we developed that the eye socket is very protective for the eye, and a lot of times if there's an injury there can be fractures of the socket, but if it actually hits the eyeball as well, we particularly worry that there could be bleeding inside the eye, which we call hyphema, or from the compression on the eye could even cause retinal problems or retinal detachments. So just like with any eye injury, we always recommend to have your eyes checked by your eye doctor after the injury to make sure that everything looks okay and healthy. With basketball, other times we may see more injuries with a poke on the eye or a scratch on the eye. And just recently in the Final Four, you may have seen that Gonzaga's Karnowski had an eye injury during the game. And you can see this frequently when people are playing down low and then getting hit or fouled, and they may get an eye injury. With these, a lot of times we worry more about a scratch on the eye that can cause a corneal abrasion that can be very painful and cause blurred vision, but fortunately it usually heals pretty quickly. Other things with racket sports, particularly racquetball, with those smaller balls coming at a high speed and from short distances sometimes, they can cause significant eye injuries. In general, the polycarbonate eye protection provides the best type of protection for the eyes. This can be in the form of a shield or a visor, like with hockey, or even baseball helmets can have a shield. Otherwise, it can be in the form of glasses that can be worn during the games. The American Academy of Ophthalmology recommends eye protection for all of these high-risk sports, although as you know, with basketball, we very rarely see people wear eye protection, maybe just if they had a severe eye injury in the past and they're being more protective. So we hope you're safe when playing sports, and if you have any questions about sports or eye injuries, please post. We'll be happy to answer them, and we'll hope to see you again soon next time on A State of Sight.